Hey, good morning and welcome to the UroPatient podcast. We meet every Saturday at 10:30 a.m. I'm your host and the producer of the show, Vic Senese. Welcome to the show. We got a really great show for you today, and let me just bring that on here. So I thought this would be a good time to talk about what's involved in a urology appointment, and it doesn't have to be awkward. Watch this first to find out why, and let's talk a little bit about that. So first of all, what actually happens in a urology appointment and why do people feel awkward about it? Well, sometimes there's a little bit of a stigma around urologic health. That's where all your parts are that are typically hidden are what we look at. A lot of the topics you want to talk about can be embarrassing for men. Maybe it's a problem with the erections. Um, Females could be leakage of urine, etc. Things that could be, personal topics. And you get in here and you just don't know what to expect. And that can always be kind of a scary thing. So I thought this would be a good time. Let's talk about it together. So the first thing I like to kind of discuss is, people are kind of, nervous about, what they're going to look at and, the uncomfortableness of probably, maybe could be a female that's looking at a male. We have female nurses as well as male nurses, but there's far more females in the business. So anyway, some people worry, well, they're going to be judgment calls. I got to tell you that I, I always approach it like this. I think that it's kind of like a mechanic. You look under the hood, you're mostly looking at the engine to see if there's a problem. Anything you're looking under the hood is just to check for things. Pretty much the engines all look the same after about your 100th or 1000th or probably 10,000s by now. So I always say, think about it. It's probably interesting for us looking at you as it is the mechanic looking at your car engine. Now, maybe I just spoiled it for all of you who bring your cars in for repair. So what does a urologist do? Well, it's a specialty where we specialize in urinary tract and reproductive system health. Common things that we're looking at are things like kidney stones, urinary tract infections, incontinence or leakage of urine, especially with prostate problems, because we do tend to take care of most of the male patients. So let's talk a little bit about what's the urinary tract look like. This is the area that we work on. We call it KUB because it's short for kidney, ureter, and bladder. So the kidneys are those organs that produce the urine up high there, as you see in the picture. The tubes that connect them to the bladder are called the ureters. And the bladder empties the urine through the urethra. So anything involved in that process, we're involved in. So what's some of the common reasons you might come in for a urology visit? Well, things like kidney stones that affect us, difficulty or pain with urination, blood in urine is usually a quick one to get people in, frequent urinary tract infections, and sometimes it's just problems with for males getting an erection, issues with low sex drive. We do take care of those problems too. Now, I always say that there is a kind of a system that you should follow when you want to come in for an appointment. This is going to make it easier for you, easier for us. Write down your symptoms and your questions. A lot of times you've got these questions, but you're so nervous you don't remember them. Write them down. Always bring a list of your medications. Very important, because there are medicines that you take that we may want to start you on something and they don't always, go along with each other so well. So always keep a list of your medications. I always say kind of avoid alcohol and caffeine. You want to be as, with it as you possibly can. Oh, and make sure you got your medical history. We need to know what surgeries you've had in the past, any medical problems that you might have. You'd be surprised how one thing could cause issues with another. Now, don't be like this guy. Don't be scared to death of your appointment. It's not necessary. We're not that scary. So what should you expect? Well, we're going to look at a medical history. We're going to review your history. Some kind of physical examination is going to be done depending on what the problem is. And there are some tests that we do, and most urologists do in the office. Almost everybody's going to need a urine sample. Think ahead. Come in with a full bladder. It'll help. Ultrasound. We do like to take pictures of the bladder after you empty to measure how much is in there. In the old days, it used to be a catheter was inserted. That was more invasive. Now it's simple. Quick little scanner, and we can tell how much urine you didn't get rid of. Some doctors' offices do blood tests in their office. So we may, if there's a blood test we need, go ahead and draw that while you're in for your visit. Hey, saves you a trip to the lab. And often you should be sitting down and having a discussion with the practitioner at talking about what's the problem, what's my diagnosis, and what are my treatment options. There's rarely a case where there's only one treatment option. Still nervous? Well, don't be nervous, because I'm going to address some of the common fears I think that we see in urology. And the number one is embarrassment. Again, for us, it's no more interesting than the engine in your car. But for you, we appreciate that it can be an embarrassing situation. But I can tell you that, we can really try to make it as easy as possible for you. Always keeping that in mind that this could be embarrassing. Will it hurt? I got to tell you, we get a bad rap. Most of the time, the stuff that we do nowadays doesn't hurt and did in the old days. A lot of the things that were done by urologists in the past were very painful, I can tell you. And I've been in this practice for 40 years. So I've assisted in enough of these pretty painful procedures that I'm really happy nowadays with local anesthetics and things like that. And many of the things that have been replaced with painful ways. Like I said, we used to put a catheter in everybody to check to see how much urine they left behind. Now we can do that with a simple ultrasound. Will the doctor think of me? I mean, it's kind of, I joke a little bit about it that, kind of coming to see us is almost like going to confession. You confess your problems, but we're the same way. We're not going to make any judgments about those problems or concerns that you bring up. So you should feel relaxed to tell us whatever you need, because it's going to help. Urologists are professionally trained to handle these situations. We know what to expect. This is not going to be a surprise. I can tell you that in 40 years, I, at this point, can't tell you too many things that patients have said that surprised me. Now, it's always a good idea to try to reduce your anxiety level. Things like taking a deep breath, relaxing, that helps. Keep in mind the reason you're here. Your health is our priority. We want to make sure that you stay healthy. Bring a friend, bring a family member. Sometimes it helps to calm you down. Sometimes you don't want them involved. So you decide whatever is going to work to make you the most comfortable. That's what we want. Now, real patient experiences, I thought it's a good time to kind of talk about that a little bit. One of the reasons that I decided to do this talk was I get comments from you guys that are watching the show. And one of the comments I received was a comment from somebody who said, "Oh my gosh, I can't believe that there's women that work in urology offices. It should be all men." Maybe, but we do take care of both women and men. But I can understand where men could be concerned or embarrassed to have a woman taking care of them. I got to tell you the reality. Our practice was lucky enough. I'm a registered nurse, and I've been in, one of the benefits of urology is a lot of guys are more comfortable having a guy there. No doubt about it. But the reality is only about 15% of all nurses and medical assistants now, because a lot of the practices are using medical assistants as well as RNs or in place of, only about 10 to 15% are male. So the chances of you getting a male when you come in for your appointment, men, sorry about that, is about 10 or 15%. So you can seek it out. You can certainly call and ask when you go in to make your appointment. Hey, do you guys have males that take care of patients? I think that it's going to be hard to find, unfortunately. And remember, these women that are taking care of you are professionally trained. This is not something new to them, and they're not going to be making judgment calls. So what should you ask the urologist when you come in? You should kind of find out what could be causing my symptoms. Ask these questions. What test am I going to have done? And what are my treatment options? Again, write these things down. I always say it's a good idea to have something, to remember this stuff. I've been a patient myself, and I can tell you that once they start talking, sometimes your head just kind of goes blank. So make sure you write those things down. That's where that second person can come in handy. And remember, there's always going to be follow-up care. So it's important to keep your follow-up appointments, whether it's for a procedure you had done or planning surgery or whatever. Make sure you have that follow-up appointment. It's really important. And you want to monitor your progress and know that treatments are going to be adjusted. We might start you on a medication. It doesn't work. You're going to start a different medication. So those things are very important. And it's important to be proactive. It's your health. Remember that. Let's do a little myth busting here. I used to watch that show, Mythbusters. Urology is only for men. Well, I think we kind of made that clear. It's not. Women have, bladder cancer, so they can come in with blood in the urine. They have kidney stones, just like guys get. So a lot of problems that affect both men and women are treated by urologists. So it's not just a man's place. Now, I mean, you may notice in the waiting room, there's more men out there, but it's not strictly men. All urology procedures are invasive. Well, we just myth busted that one with the catheter we no longer have to put in. That's an invasive procedure we can do with an ultrasound, a scanner. A lot of imaging studies replace what used to be more invasive. Now, do we do invasive procedures? Absolutely. You can watch all the procedures on UroPatient to see what things we do, such as cystoscopy, that are invasive. But we also use local anesthetics to make these things much easier. It's not serious unless it's painful. Some people think that I hear that all the time. The patient will come in and say, I've got absolutely no symptoms whatsoever. And they came in with an elevated PSA, a man screening for prostate cancer. And they go, but I have no symptoms. That's when you want to catch these cancers, is before you have symptoms. Once you have symptoms, tends to be too late. So, yep, if it doesn't hurt, doesn't mean it's not broke. So be sure to be following up on things. So key takeaways from this talk, the reason I'm giving it is to make sure you know that your health is more important than your embarrassment. Yes, we realize it may be embarrassing. Stuff we do can be a little embarrassing, but it's more important that you take care of yourself. We're here to help. Urologists, the nurses, the staff, they're all here to help, not to judge. We're not going to, we don't have a book we write down. Wow, that was, this was interesting. It's not. Preparation, again, can make the whole appointment smoother. That list of medications is huge. I can't tell you how many patients I've asked them, are you taking any medications? And they look up in the sky as if God was going to deliver the message. No, it's better now with electronic medical records. Some of the pharmacies we can connect to and get your records, but maybe you stop taking those for some reason. You know what you're on. You should know what you're on, and make sure we know. Early care can make big problems smaller. So, they can prevent bigger problems from occurring. So always get in sooner than later, right? There are some other support things that you can do. UroPatient.com, the show you're watching right now, I think has been a great support. We've got all these handouts you can always look at, and there are support groups and forums that you can look online and check things out. I will make a little comment about a lot of people refer to Dr. Google. Look it up on Google and think that that's all the answers, or watch a video on YouTube about it. Sometimes they're not always that accurate, so keep that in mind. It's like everything else, people want to get more hits on things. Well, good news doesn't sell, bad news does. And that's kind of the case. And it's really not the way we practice. So it's not the bad news that you're going to find. So I hope this was a big help for you. If it was, great, leave a comment, and we'll continue to have great things for you in the future. Tune in next week for our next episode of UroPatient.com.